Okay, I think we must be live already.
Yeah, it's being live streamed.
Yes, it is being excellent. Welcome back. It's been quite a long time since we did our live session. Welcome to another very scintillating conversation to a Famhealth Live. Today, I am delighted to announce a alliance that we have struck with Moorchand Hospitals. Facing you as part of the screen is Dr. Sidharth Sahni.
Hi, good afternoon.
Yes. Thank you. We will talk to Dr. Sidharth Sahni, but this is part of an ongoing series that we're doing starting today. So, Dr. Sahni, you are our, first backs person. You are going to start the innings of Moorchand Health Talks with Famhealth, powered by Famhealth. What a privilege it is to join hands with you. Thank you very much.
Likewise.
Thank you. So, today's conversation is with Dr. Sahni. So Dr. Sahni himself is Maulana Azad Medical Institute college pass out somewhere in the mid-90s, if I'm right, Doc?
Yeah.
And then you
early 90s.
Early 90s?
Early mid-90s, yeah.
Okay. Sorry if I'm talking over you. There is a slight lag, but I'm sure we'll get the rhythm. So, yeah. All right. Moving on. You went to Edinburgh and you specialized in breast surgery, and
Yes.
you are the breast man of India, I believe. What do I need to know other than the fact that you have come to Moorchand recently, about 6 to 8, 10 months back? You have to change the landscape and your ex-Apollo hospitals. Tell us what I haven't already covered, Dr. Sahni. Let India know what you're doing.
I'm pretty much, you've covered everything. Yes, I've spent a glorious decade with a lot of very good colleagues, friends at Apollo, doing some good work. And then I moved to Moorchand in October of last year, where the look is in the future towards expansion and also to create facilities which are world-class and have fun. I think I'm at a point in my life where I can still take up that challenge. I think about if I would have waited another 5 years longer, it would have been very difficult to do at that point. So yeah, I'm just excited about it. I'm also involved with the new variety of science, which is biotech, part of a structure which will be announced shortly by the organization that I'm with. So I don't want to expand too much on it because there is NOC to that that I've signed. So yeah, it's exciting times to be here. And I think very grateful finally to have some sort of normality back after 2 years of being locked down. My first reaction to my colleague who asked me to come on this was not another online interview. It was just 2 years of webinars, and one of the conferences that's closest to my heart, which is the annual Tata breast cancer conference in India, which I think is one of the premier cancer conferences, if not the premier cancer conference in this country. To have to do that 2 times online was just, it used to be a highlight for every January. And to do it in 2021, this year I was invited, but I couldn't because I came down with the COVID-19 infection myself. So I was in a pretty bad shape for a couple of days. But yeah, that's hopefully, fingers crossed, we won't go down those paths again.
Yeah, hopefully. Although you don't know, I've just been hearing reports as we talk right now about COVID cases increasing.
Mm-hmm.
So I hope we can beat this infection. It's just such a nightmare to deal with this. Yeah.
Yeah, I mean, the reason there's a particular reason that I bring up the COVID, even though I haven't treated anybody, is that what people, when you look at COVID-related deaths, you look at the actual numbers which you'll be looking at. What people aren't really discussing is, for example, breast cancer. All across the world, diseases which should have presented as stage 1 diseases, early breast cancer, are now coming in as late stage 2, stage 3 diseases because people haven't had access to hospitals or been sick or had family members who were sick. So, to get to hear that, yeah, I found a lump 2 years ago and then lockdown happened. And then I just couldn't get it checked. And then I have to tell the person, I'm sorry, it's spread all over your body. There's very little we can do. That's not fun either. So there are a lot of indirect. In the US reported in 2020 alone, the first wave where their health system was completely disrupted, a 22% increase in cancer-related mortality. That from the US, that's just unheard of.
In fact, yeah, one of the problems which happened, and I thought we'd cover it as part of our conversation as we go along, and specifically target our conversation on cancer, is that even after detection, and all the oncologists that we've been talking to through the last 2-year period, have one complaint to make, which is that patients are so scared of getting to a hospital at all.
Absolutely.
Or of catching an infection. So delayed treatment is another reason for it to become so foul. And that was going to be my question a little later down. But just before we jump into cancer, Doc, what are the, you're a breast surgeon, what kind of issues are you, do you usually deal with? What are the common problems? I think cancer would be one.
No, so the 3 commonest problems, or let me say 4, because in India, that's how it happens. The 4 commonest problems are breast pain, which can be associated with the menstrual cycle, or is, especially in menopausal women, not associated with the cycle, but still there. The second is a lump, which could be malignant or which could be cancerous or non-cancerous. And the third, which is very common, is a nipple discharge. I'll touch on the first 2 because I'm sure you'll have questions for me on the lumps. So surprisingly, breast pain, when it's in the reproductive age group of women, and please tell me whenever you want me to switch to Hindi, I'm very happy to do that.
Actually, we should. In fact, मैं बोलने वाली थी कि थोड़ा हिंदी में भी बात कर लेते हैं.
So जब हम उसको reproductive years बोलते हैं, जब भी वो समय होता है जब एक स्त्री को माहवारी आ रही होती, periods आ रहे हो. So that's considered to be the reproductive phase. So उसमें अगर breast pain हो रहा हो, वो typically periods शुरू होने से हफ्ता 10 दिन maximum 2 weeks पहले in severe cases शुरू हो जाता है. And वो basically hormonal कारण से होता है, because एक hormone होता है, 2 hormone होता है जो आपको एक स्त्री बनाते हैं. एक होता है estrogen, दूसरा होता है progesterone. तो ये पेन जो है ब्रेस्ट में जो पीरियड के पहले होती है, या जो सारे प्री मेंस्ट्रुअल सिम्टम्स जो आते हैं पीरियड के पहले, दे आर बेसिकली बिकॉज ऑफ अ राइज इन प्रोजेस्टेरोन. एंड there is a way to deal with it, and the most common way is not really the short term method. जब हम दवाइयां देते हैं वो basically 6 हफ्ते के लिए होती है, that's the most effective time. लेकिन उसका आंसर डाइट में है, and that's another thing that I'm involved or getting involved in, which is called functional medicine or functional nutritional therapy, which looks at you as a person, and just through diet हम आपके जो parameters जो गड़बड़ हो रहे हैं उन्हें हम correct कर सकते हैं, and that can disappear. But उससे भी ज़्यादा common जो cycle के अलावा जो pain आती है उसका सबसे बड़ा कारण होता है cervical spondylitis. Okay, and we've seen a huge increase in that क्योंकि पिछले 2 साल में सभी लोग अपने कंप्यूटर पे या आईपैड पे या फोन पे बैठे हुए हैं और नेटफ्लिक्स देख रहे हैं, प्राइम देख रहे हैं, वीडियो गेम्स खेल रहे हैं. So your neck is always bent like that.
Yeah.
The third is discharge. So a lot of women come with discharge. Nipple discharge is only is really important, not by just the color, but 3 चीजें. Spontaneous, अपने आप आता है वाला, one side usually, and then color. People get very scared about blood, कि blood आ गया, problem हो गई है. More or equally dangerous जो color होता है discharge का, वो पानी का color होता है, or what we call colorless or transparent. So if it's spontaneous, if it's single-sided, and if it's the color of either blood or water, then you need to go to a breast surgeon ASAP. But any discharge which comes by pressing is usually 99.9% not dangerous. But of course, everyone requires assurances and a need to find out why something is happening. And so these are the three, and of course the fourth is, being India, there are people who come for second or third opinions, and they have the whole list of investigations done from top to bottom. So they are, yes, I would call people with breast cancer who also come directly for an opinion and for management options.
Okay. Dr. Sahni, let's talk about the second case थोड़ी देर के लिए. आपने lumps के बारे में बोला, right? And Hali, this kind of a problem a friend of mine dealt with. In fact, increasingly, बहुत सारे, I guess हम थोड़े बुजुर्ग हो रहे हैं, तो हमारी यही किस्म की problems हम spot कर रहे हैं. But lumps is a big issue when it comes for women. And तो automatic scare तो है कि oh my god, breast cancer तो नहीं हो गया ना. You said that it could be related to the cervical.
That's pain. That's pain. That's breast pain. Breast lump has got nothing to do with cervical spondylitis.
Correct. Because somebody told me कि ये शायद मोटापे से कोई connection है, तो ये lumps क्यों होते हैं?
ठीक है. So basically, lumps are formed due to a couple of reasons. Let's take the most commonly found lump in the body, in the breast, which is इसको हम fibroid या fibroadenoma बोलते हैं. ये प्यूबर्टी जब आप एक लड़की से स्त्री बन रही होती है, वो 8 या 10 साल प्यूबर्टी के दौरान बनता है, और ये बीमारी नहीं है. ये बेसिकली एक डेवलपमेंटल अनोमली है जो कि हो सकती है क्योंकि आपके हार्मोन्स are all over the place. So it's a little breast which forms within a breast. My job, or any other breast surgeon's job, is to deal with a lump in a very objective fashion. Because yes, every woman is scared that if she finds a lump, usko apni breast mein lump milega, to dikhate nahi hain, batate nahi hain, kyunki dar lag jayega ki cancer to nahi. पर अगर 10 औरतें हैं अगर क्लिनिक में, और उनको 10 की 10 को वही इन्वेस्टिगेशन पाथवे पे हम डालते हैं, क्योंकि अगर हमारे से एक भी कैंसर मिस हो गया तो वह एक जान, not just one life, but it's also a whole family. Because remember, the woman is, however much male centric Indian or society is, the woman is the heart of the family, in every possible way. So it affects families as well. And the earlier you take it out, or the earlier you address it, there's actually now, I can say in the 21st century, that अगर आप अपना मैमोग्राम हर साल कराएं, 40 के बाद हर साल मैमोग्राम की जरूरत है, और अगर आप उसको हर साल कराएं, गॉड फॉरबिड अगर उसमें थोड़ा सा भी नुक्स आता है, it can be completely cured. Nobody with screen detected breast cancers is ever going to die because of the breast cancer. You'll only get better. Not only that, इसके इलाज में भी जो late stage के हिसाब से financially also, it takes about 10% of the amount of money it would take to cure you than to just treat you. So that's the reason why we keep trying to push people. And
early investigation.
Yeah, and the investigation pathway, when somebody comes to me with either a screen detected change, or they felt something, or the partners felt something, is essentially worldwide the same. It's called triple assessment. इसमें 3 चीजें होती हैं. एक तो जो हम हिस्ट्री और एग्जामिनेशन करते हैं, दूसरा हम जो बोलते हैं इमेजिंग अप्रोप्रिएट फॉर एज. सो उम्र के हिसाब से जो ब्रेस्ट की इमेजिंग कर सकते हैं हम, वो सारी करनी चाहिए. और अगर हमें फिर भी लंप मिलता है, आइडेंटिफाई होता है, तो सुन करके एक मोटी नीडल लेते हैं और उसको बायोप्सी बोलते हैं. And we do that, and that's called triple assessment. और इसका जो accuracy rate है वो 100% है.
Okay, तो आप कह रहे हो कि जितनी जल्दी करवा सकते हो ये, उतना बेटर है कि अगर it becomes a serious issue, तब खर्चे भी होंगे and you won't be able to control it.
Yeah.
So in fact,
fortunately, अगर like I said, अगर मैं 10 ladies को one after the other triple assessment के लिए भेजता हूँ, the chances of a cancer would be in 1, maybe 1.5 women. So 10 to 15% max. The other 85% to 90% will be non-cancerous. And most of the time, non-cancerous lumps don't really require anything doing to them.
तो एक चीज बताइए सर, आप कह रहे हैं कि एंड दैट्स रीअश्योरिंग. अब जो सवाल आता है ज़हन में, आपने ब्रेस्ट कैंसर पे बात की है, एंड आई थिंक वी शुड स्टार्ट टॉकिंग अबाउट ब्रेस्ट कैंसर a little more focused manner में, and there are a couple of questions which have come up on breast cancer as well.
Yes.
Why is there an increase of breast cancer or cancers in India? जब हम बचपन में तो बहुत कम लोगों को सुना था कैंसर है, पता नहीं whether they were diagnosed or otherwise, but now it's just every other person, every family में कुछ हो रहा है. तो क्यों हो रहा है?
Yeah, I mean it's lots of things. पहले तो जब हम छोटे थे सुनने में नहीं आता था क्योंकि one of the possibilities is we didn't have the tools to discover it, right? The second, which is one of my pet theories, is actually the advent of junk food, because if you look at the junk food industry, उसकी जो नींव है वो दो चीजों से बनी हुई. एक है चीनी, व्हाइट शुगर, और दूसरा है रिफाइंड कुकिंग ऑयल, जो कि बार बार वही तेल जो है दिन में सैकड़ों बारी रीहीट होके रीयूज हो रहा होता है. Okay, and this is enough studies in nutrition which have shown that refined oil, particularly if reheated, even on its own, but if reheated, is a disaster, because उससे क्या बनता है, free radicals बनते हैं और ये DNA को damage करते जाते हैं. And if they damage the DNA enough or at a rate faster than what your body can repair, then you're very likely to get a cancer. The second is sugar. I mean, हमारा शरीर एक sugar factory है. हम sugar बनाते हैं. हमें sugar की आवश्यकता नहीं है क्योंकि हम चीजें अंदर लेके उसको sugar में convert करते हैं. लेकिन अगर आप एक फैक्ट्री को गोडाउन बनाना शुरू कर तो वो फैक्ट्री की एफिशिएंसी का क्या हाल होगा, उसकी प्रोडक्शन का क्या हाल होगा, उसके वर्कर्स क्या करेंगे, वो स्ट्राइक पे जाएंगे, आपको अटैक करेंगे, मैनेजमेंट से लड़ेंगे. I mean, of course, that's the most simplistic assessment I'm trying to give you. That's not exactly what happens. But yes, I think if you take these two things out of your diet, and they weren't there 40, 50 years ago in our lives, you heard of very few cancers. I mean, of course, you can never, underestimate tobacco. And there are studies which say that if tobacco and tobacco relate in all its forms, smoked and unsmoked tobacco was taken out of the equation, then 60 to 62% of the cancers would vanish overnight. And now you also, अब हम देख रहे हैं पिछले 10 साल से कम दिल्ली में जो एयर पोल्यूशन का लेवल है वो इतना खराब बताया गया है कि कई दिन तो ऐसा लग रहा था कि 2 पैकेट सिगरेट के आप पी रहे हो.
Correct.
So there's a lot of pollution, there's a lot of emphasis on fast food, junk food. I don't know about you, but मुझे तो कभी याद नहीं है बाहर से पिज्जा जो भी बनता था वो घर पे ही बनता.
उस जमाने में था नहीं ना, मतलब
we didn't have access to it.
Growing up, we didn't have fancy chains. Since I can't take brand names, there were only एक दो जगहें थी. And I guess
exactly. And you were allowed to go. हमें allow करा जाता था वहां जाने के लिए जब जैसे एग्जाम्स खत्म हो जाते थे या आपकी रिजल्ट आती थी. It was a treat. It wasn't a norm.
True.
And today with टेक्नोलॉजी के एडवांटेजेस हैं, डिसएडवांटेजेस हैं. आज आप घर बैठ के कई एप्स हैं, मैं नाम भी नहीं लूंगा बिकॉज इट्स अनफेयर टू से वन. घर बैठे बैठे कहीं से भी कुछ भी ऑर्डर कर सकते.
Correct. I know, and I think they're doing a big disservice in the space of health. But वो मेरा personal view है, क्योंकि अब तो मेहनत भी नहीं करनी है जाने के लिए कहीं. You know?
Exactly.
Yeah,
exactly. So those are the reasons essentially for the increase in cancer. Plus, of course, technology that now allows us to identify disease earlier and potentially pick it up earlier and treat it earlier. So lots of factors. It's not one thing, because cancer क्या होता है? In a nutshell, cancer एक ऐसा सेल है जहां पर आपको या तो inherited defect जेनेटिकली डिफेक्ट आया है या फिर इन कारणों की वजह से आपने उसको अक्वायर करा है, जो और आपका डीएनए इतनी बुरी तरह से डैमेज हो गया है कि देयर इज समथिंग कॉल्ड प्रोग्राम सेल डेथ। हर एक सेल हमारे शरीर में जब पैदा होता है उसका लाइफ स्पैन प्री डिटरमिन्ड होता है। वो अपना फंक्शन करता है, अपने जैसे 2 सेल्स देता है, फिर मर जाता है।
Okay.
There is enough damage in these cancer cells that they have forgotten the ability to die. So they just keep reproducing. That's why treatment की जरूरत होती है, क्योंकि अगर आप उसको ट्रीट नहीं करेंगे तो वो बढ़ता जाएगा, उसको मरना नहीं आता है। क्योंकि उसको मरना नहीं आता है, हमें उसे मारना पड़ता है। इसीलिए उसको कैसे मार सकते हैं? 3 चीजों से। हम उसको काट सकते हैं, which we call surgery, उसको जला सकते हैं, which we call radiation, और उसको पॉइजन कर सकते हैं, जिसको हम कीमोथेरेपी बोलते हैं, दवाई से। और आज की तारीख में मोस्ट पीपल, स्पेशली ब्रेस्ट कैंसर में, तीनों 95 to 99% of the time तीनों चीजों की जरूरत पड़ती है। But the cure rates I've now been doing breast for 27 years. The cure rates in 27 years have gone from low 80% of early breast cancer to now 96, almost 100%.
Wow.
So that's the other aspect that we, use to encourage women to go and screen themselves.
तो सब प्रिवेंटिव, देयर सो मच टू टॉक अबाउट। तो हमें ट्रीटमेंट के बारे में तो इन डेप्थ जाना है, पोस्ट ट्रीटमेंट के बारे में भी, मैं पोस्ट सर्जरी उसके बारे में भी बात करनी है। तो वेरी रैपिडली अगर आप प्रिवेंटिव या रिस्क फैक्टर्स, आई मीन यू सेड कि हमारा लाइफस्टाइल काफी भद्दा हो गया है आजकल, एंड इसके कारण, एंड आई एम श्योर देयर इज नो वन सिंगल रीजन लाइक यू yourself saying, but when is it that I should take this seriously?
No, there's no, as you say, unless there's a genetic defect. जैसे सबसे फेमस जो हम सबको पता, दुनिया भर को पता लगा था जब एंजेलिना जोली ने अपनी जेनेटिक टेस्टिंग कराई थी और फिर ऑपरेशन कराए थे. So that we understand, everybody now knows what I call the Angelina Jolie gene, which is the BRCA 1 and 2 genes. And there are other genes which we are now finding out, check 1, 2, etc., where if you have that defect, then your lifespan or lifespan risk of developing a breast cancer is over 65-70%, which means you are going to get it pretty much in your lifetime. So if it's not inherited, what can you do? Well, try and avoid as much junk food as possible, or if you have to have it, learn to make it or get somebody to make it at home in the right oils, and avoid white sugar and white sugar products. Say no to tobacco in any form. And I think there's a paper I read in 2018 which looked at what we call adjuncts to treatment, which means what lifestyle issues जो आप follow कर सकते हैं. And सबसे important जो उसमें statistically significant adjunct था, वो था exercise.
Oh, okay. Which means करनी चाहिए बहुत सारी exercise.
Yeah, you should. I mean, exercise does a lot of things. It grows muscle, it cuts fat, it improves blood sugar utilization, keeps the blood sugar below 90, and the fact that you might look good or well toned, I think is a side effect, because there are many more physiological reasons to exercise than just to look good, or get into a swimsuit or get into a bikini or whatever dress or whatever it is
that is want. Collateral damage.
That's collateral damage.
Collateral damage. पहले अपनी health संभाले, and you'll also look good.
Yeah, and a good diet, and take care of your body, because there's a lot of so when we were growing up, I don't know, in my generation, I can't remember anybody having something called PCOD, polycystic ovarian syndrome.
शायद पता नहीं था हमें उस टाइम पे ना,
we didn't even know about it, right? Today you find women, girls in their 20s and 30s, maybe even their late teens, at least 60% have been diagnosed with PCOS, and there is a direct link between junk food and polycystic ovarian syndrome. It's there. So I do sound like the sort of people I used to quite despise when I was much younger. But diet is really important, and the more you look after your diet, the better your chances of living healthy.
And preventing any onset of any disease, right?
Yeah, and try and prevent it. I mean, look, not every breast cancer patient that I have is overweight. We also know from studies that have been done in obesity that women who are obese, and obese is a medical definition. It's height is to weight ratio. It's not how you think you look. So even if somebody doesn't look very fat, but they could still be medically obese for their height category. So obesity increases the risk. Again, is a risk. People ask me, what can I do to prevent it? Well, keep your weight. Again, we go back to diet and exercise. Keep your weight under within the normal limit, because that actually reduces your risk of developing a cancer by up to 30%.
ओके एक सिंस आप डाइट की बात कर रहे हैं, सुनने में मेरे तो सुनने में आया है, आई डोंट नो वेदर इट्स मिथ और इट्स रियलिटी, व्हिच इज कि खट्टा खाना चाहिए इफ यू वांट टू अवॉइड कैंसर. So I cannot visualize eating copious amounts of nimbu. Honestly, I hate khatta.
No, look, there are various diets knocking around. Some say keto karo, ye karo, wo karo. So for me, the most balanced diet in the world is probably found in the Mediterranean. Okay, और खट्टा खाने से या कुछ नहीं. You got to work on the दो चीजें आप समझ लीजिए. हर एक बीमारी जो है, हर एक बीमारी, चाहे वो इन्फेक्शन हो, चाहे वो कैंसर हो, चाहे इम्यून डिजीज हो, हर एक बीमारी जो है वो एक एसिड मीडियम में होती है. ठीक है. और हर एक दवाई जो है, आप क्रोसिन लेके देख लीजिए. Put it on your tongue. It tastes awfully bitter. कड़वी लगती है, बहुत कड़वी लगती है हर दवाई जो आप खाएंगे. Why? Because उसको वो alkaline होती है. Okay, so this is school boy chemistry. Properties of bases, they're salty. Acids are sour, and by you neutralize the reaction. So acid plus base, salt, neutral salt plus water, and that's really how your food should be combined. So अगर आप देखें diet में खूब सारे हरे भरे पत्ते, purple, all of that, salads are there, and that's all alkaline. The mushrooms, that's all alkaline. And then they'll have some meat or fish or whatever which is acidic, slightly acidic. And then you have because हमारे शरीर का जो pH है, जो balance है, वो थोड़ा सा alkaline है, 7.34 to 7.43, controlled so tightly. So you've got to make sure that you don't have, which is why again eating too much meat and not having enough vegetables with it is such a huge risk factor for colorectal cancer, because your body needs those greens. It needs the neutralizing factor to the acid which you're taking, which is also important. Otherwise, you won't get protein in your system. But that's really what a good diet is. Then, as I said, I'm involved with functional nutrition. Then we analyze really at molecular level what's working in your system, what's not working in your system. But that's on a case-to-case basis. It's impossible to give a general overview of that.
So इस समय दो चीजें I'd like to tell our viewers and also you, sir. For about 3 years or 3.5 years, we've been working quite closely with a functional medicine expert from New York. So, in fact, she's in India right now. So उनके साथ हम she's been practicing functional medicine for about 11 or 12 years. तो सारा आप content please आइए www.famhealth.in पे. आपको सबसे पहले Mediterranean diet type करिए in the search counter and you'll see what doctor has been talking about. We've covered all diet types in that. Also, functional medicine क्या कहता है and what are the foods to eat and not eat. Please come explore our site. And we take this really seriously as well. But I look forward, अगर आपने इस area में बहुत रुचि दिखाई है, then we definitely need somebody here, and it would be such an honor to find out what it is that you would recommend. But
No,
that's
we once this is over, we can. I mean, I would.
I
I was going
should.
to say.
Yeah.
I was going to ask you to forward me the link of the website because
I will.
yeah, it's
I
something
will.
I'm passionate about.
Yeah, excellent. So in fact, I will put you on to Mona Johar. She is a lady that we've been working with, the functional, and she's passed out from the Texan Functional School of Medicine, Functional Medicine, right? So she's,
Yeah.
and she practices, and she's reversed quite a few conditions.
Yeah.
And that's a good part. I will do that. Moving on, when it comes to cancer, those signs, symptoms क्या होंगे breast cancer के? And before I forget, एक हमारी प्रीवियस कॉन्वर्सेशन में डॉक्टर आपने बोला था कि अगर मम्मी जेनेटिक फैक्टर्स हो सकते हैं, आपने कहा था, विच इज कि बुजुर्ग अगर किसी को फैमिली में कैंसर है, ब्रेस्ट कैंसर है, तो चांसेस आर कि बच्चे को भी होगा. व्हाट आर द अदर कैंसर टाइप्स? मतलब यू वर सेइंग समथिंग अबाउट प्रोस्टेट.
या सो एक बहुत इंपॉर्टेंट चीज है, वो है कि इंसान के शरीर में 3 तरह के कैंसर्स हो सकते हैं. एक होता है ब्रेस्ट, दूसरा होता है प्रोस्टेट का कैंसर, और तीसरा होता है ओवरी का कैंसर. Fortunately, ovarian cancer is increasing in numbers like other cancers, but it's not that common. पर आदमियों में प्रोस्टेट कैंसर होता है, सिर्फ औरतों में हो नहीं सकता, और औरतों में ओवेरियन कैंसर होता है, आदमियों में हो नहीं सकता. So, अगर फैमिली में किसी को भी दादा, नाना, फादर, चाचा, ताया, मामा, किसी को भी प्रोस्टेट कैंसर है, then the next generation, the girls, it's not just the boys who are at a high risk of prostate cancer, but the girls are at a high risk of breast cancer. So if you have a family history of prostate cancer, you should consult your doctor, start screening, and take advice about, because very often जब हम पूछते हैं कोई कैंसर की हिस्ट्री है, patient and attendant are thinking नहीं, कोई breast cancer तो हुआ ही नहीं हमारे family में. Then you dig a little deeper and then, oh, there's so many times, yes, my uncle had it, my father had it, my grandfather had it, prostate cancer. And of course, any other cancer does predispose you to developing a cancer. You asked about signs and symptoms. Well, I'll go into that. But सबसे पहली चीज जो याद रखने वाली ये है कि mammogram, people ask me, mammogram कब कराएं? The best time to get a mammogram is जब आपको कोई symptom नहीं हो, when you don't have a symptom. So it's like doing a lipid profile. What's a great time to get your lipid profile? When you haven't had a heart attack, right? Or a stroke, because it tells you what your potential risk is. It's the same thing with mammogram. And if you find something, if there is something which is what we call screen detected, where you don't have a sign or symptom, then the chances of a cure rate are, as I said, almost 100%, with a small surgery, very, very often, very little treatment, other treatments needed. Otherwise, like I said, so now what we do is we don't tell you that these are the 10 or 15 signs or symptoms. What we tell you is, look, once a month when you're in your shower, just, examine yourself and look for a change. That change, वो change कुछ भी हो सकता है, लेकिन आपको लगना चाहिए कि ये थोड़ा सा बदला हुआ लगता है मेरे. So look for any change. Of course, classical signs are, is there a lump? गांठ आपको फील हो रही है? निपल से डिस्चार्ज हो रहा है कि नहीं? निपल का शेप बदला है कि नहीं? If the nipple is normal and it suddenly starts looking like it's been drawn in, that's a huge concern. Any itching, especially on the nipple, especially only on one side, it needs to be shown. So any change to the skin, anything that you think is different needs to be shown to a doctor at the earliest possible. And that's really the bottom line, that don't try and think that, oh yeah, this is related to my period, or this might be an injury that I had. Nothing. It's the most, sometimes breast cancer comes out with the most ridiculous signs and symptoms, but we have to watch for everything.
So unpredictable है आप कह रहे हैं.
Yeah, it's very unpredictable.
आपको अलग लगे तो दिखाएं. So is this true? And I know it sounds like a silly question, but is it only for women that you recommend this, or because I've been hearing about breast cancer in men? Also,
there is breast cancer in men, but much less frequency, which is why we don't recommend screening mammograms, because you'll have, for every 20,000 breast cancers in women, there's one in men. So, as I was discussing with you earlier, um, it's actually much easier, and it's the same disease that women get. Just by the way, it's not a different disease, and but there are some underlying conditions that predispose to male breast cancer. One is an inherited gene, which is called the BRCA gene. So, anytime there is a male member of the family who has breast cancer, not only is that gentleman tested for BRCA or this gene, but all the family members, all the female family members are also tested for this gene. And you can be pretty sure that there will be female positivity there. So the other, I mean, liver failure, excessive alcohol, I mean, by the time they say it's there, and there are certain other genetic conditions, but I mean, by the time you get breast cancer because of excessive alcohol, you probably died of cirrhosis about 3 times over. But it's all these things. And men, it's so easy for us to feel if there's a lump, because there is no fat, there's no breast tissue by and large.
okay.
But the more important thing men need to do, which is quite well publicized in the West, is actually just when you're having a shower, just like we tell women to do their checks for the breast, is actually do a testicular checkup, because you're going to be washing that area in any case. So it's very easy for you to find out if there's a change, or if you think there's a change, go early, because again, another superficial cancer that you can pick up. And men really do need to start doing tests to see if they have. So what we used to recommend was a blood test called a PSA level, which is prostate specific antigen. But recently, just this year, as a matter of fact, there is a genetics company which has got FDA approval for a gene-based test, which looks at do you have prostate cancer or not, and it is about 100 times more sensitive than PSA and accurate. And they've done all the trials, and now it's being introduced into the mainstream in the US, UK, everywhere. So it's so much easier. It's available in India as well.
What's your point of view on genetic tests? Test whether you are susceptible and high risk.
So the way it was done earlier was you were only testing for a few genes, right? Now you can test for a whole bunch of genes and figure out. But genetic testing is, the actual process is very easy, but it's got a lot of issues with it. So you need genetic counseling. You need to understand, if you're going for that test, what are the likely outcomes, and how उसका आपके ऊपर, आपकी फैमिली के ऊपर क्या असर हो. Because लोग कराने को टेस्ट तो बड़ी आसानी से करा लेते, लेकिन उनको जब पता नहीं होता है कि इसका इम्पैक्ट क्या होगा, तो फिर उसमें दिक्कत आती. So you need a genetic counselor. You need that. You just can't. I don't think it's responsible for me as a doctor to just write down a test, because मरीज तो जो हम टेस्ट लिखेंगे 99% of the time वो करा लेंगे, especially आप समझाओ. बट उसका इम्पैक्ट क्या होता है, काउंसलिंग की जरूरत क्यों होगी, कैसे करेंगे आप, वो सब आपको कराना चाहिए, especially when you're getting all of these tests done. Because very often, because in tumor genomics, what you're doing is you're looking for DNA from the tumor cells. So you can actually get the DNA light up, but because the tumor is so small, it hasn't been picked up on a scan, because it needs to be of a certain volume. I mean, it needs to be 1.8 millimeters, 1.3 millimeters to be picked up. But here you're looking for cell-free DNA. So that's where a potential problem comes in. What do you treat? What do you remove? I know you've got the prostate cancer DNA roaming around in your system, but I can't see it on an MRI. I can't see it on a PET scan. So do I go ahead and counsel you and get your prostate out and do all of that. So that's what I'm saying. You need there has to be a great deal of teamwork that the patient needs to understand before they go in for these tests. But yeah, they are available.
That's very, very good observation. Acha, moving on and coming back to breast cancer. आपने बोला mammograms कराइए. So are there any other ways of detecting कि आपको breast cancer है? Do I need to not do a mammogram because should I?
No. I mean, mammos, poor things, have been so maligned over the years. You know, first they were the only thing to do. Then you had papers coming up that screening makes no difference. Yeah, you know, you go to the UK. I'm just taking one country's example. Their national screening protocol is once in 2 years. It's the same in France. It's the same in Canada, Australia, and it's once in 2 years because they cannot afford to logistically have an annual screening, nationalized screening program. It's just the logistics don't work out, the economics don't work out. And however, in these countries, Canada doesn't have private health insurance, but in the UK, for example, if you do hold a private health insurance, it will not be renewed till you front up evidence of a yearly mammogram. So it's perfectly safe. People used to tell me, or not tell me, it was more a rhetorical question almost, saying, is it safe?
Correct.
It is safe. There have been enough studies done by the American College of Radiologists which clearly show that the safety period between 2 mammograms is 10 months. Okay. So when you do it on an annual basis, सालाना कराते हैं आप, तो वो तो absolutely safe period में. और ये डेटा जो मैं डिस्कस कर रहा हूँ आपके साथ, ये 90s में छपा था. लेट 90s में, मिड लेट 90s में, जब आपके पास डिजिटल मशीन्स नहीं थी. डिजिटल मशीन्स के साथ जो डोज रेडिएशन की आपकी मिलती है, वो पुरानी मशीन से कम 30% कम है. So you're really at no risk of anything with a mammogram if it's done annually. If you do pick up something, you can save your life.
So let's talk about saving lives now. Which is the most important, and we don't have very much time left, and I want to make sure कि हम ये section avoid नहीं करें. आप surgeon हैं, आप surgery करते हैं, किस stage पे हमारे को surgery की ज़रूरत पड़ सकती है? Is it like
now essentially there are 3 types of breast cancers: early breast cancer, a locally advanced disease, and systemic, or what used to be the old stage 4. Early breast cancer usually means that you will require surgery up front. Okay. Surgery is essentially of 2 types. One is breast saving and the other is breast removal. The amount of breast removals that I've done in the last 5 to 6 years is almost 60 to 70% less than what we used to do. And that's essentially, not 5 to 6 years, last 10 years. And that's essentially because of standardization of practice all across the world. And जब भी जो बड़े lumps हैं, उनको हम about 80 to 85% of the time हम उनको chemotherapy देके पहले छोटा कर सकते हैं, so that we have to remove less. Results are fantastic. So the other thing I'm asked is, नहीं पूरा निकाल दो, वापस आने के chances नहीं होंगे. That's a myth. That more is better. It's not that. And like I said, whether it's early or locally advanced, most patients will get all 3 forms of treatment: surgery, chemotherapy in some form. Chemotherapy is Latin for drug treatment. So it can be given intravenously, it can be given as a tablet, it can, yeah, there are various ways of giving it, with every type having different side effects. And radiation therapy is just high voltage X-rays to the breast. जब लोग मेरे से पूछते हैं कि जी रेडिएशन की सबसे बड़ी कॉम्प्लिकेशन क्या है, मेरा जवाब उनको होता है दिल्ली का ट्रैफिक. बिकॉज आपको 3 हफ्ते के लिए हर रोज 10 मिनट के लिए जहां आपको रेडिएशन मिल रही जाना पड़ रहा है. And you can imagine, unless you're living very close to a hospital, it can, or your treating center, it can, the traffic, now that it's back up to normal in Delhi, and other major cities in our country can be an absolute nightmare. So these are the three forms. Other one point that everybody asks me when I was coming back to more is better. Breast conservation is not a cosmetic operation. Okay, it's a fully established surgery which has been trialed over hundreds of thousands of patients for cancer. It's patient selection which is important. And if for some reason, agar as a patient आप radiation नहीं करा सकती हैं क्योंकि you live too far from it, financially not affordable, any other medical condition, it's only then that it's very prudent to have the whole breast removed. Because now the indication for radiation after breast removal is also there in about 70% of cases. Earlier we used to say agar aap radiation nahi karana hai to fir aap breast nikalwa dijiye. I think now the only absolute condition जिसमें हम breast निकालते हैं कि एक breast में अगर एक से ज़्यादा focus है cancer का तब breast निकालना mandatory हो जाता है. Otherwise it's not. And you know the advances in surgery have been. Sorry.
So I'm sorry. So when you say breast saving, right? What is it that I as a patient should know about it? Matlab breast saving kya? Then do I not need that? That means my breast is intact. I mean, I know it will depend on the largeness of the lump, but मैं क्या expect कर सकती हूँ breast saving?
No. So I mean from a technical aspect, when you do, somebody like me, when I do a breast conserving surgery, the one thing that we are taught during training is kitna volume nikalna chahiye. So you have to take out less than 25% of the breast volume, ideally. Okay. And if you can't do that, then either don't attempt the surgery, because the one thing that should not change for the woman is her bra size. Okay, that's also changed in the last 15 years because एक चीज नई type of surgery आई है, उसको हम बोलते हैं oncoplastic surgery, where we use the principles of plastic surgery to be able to still do breast conservation and still maintain the shape and form of the breast. So that's honestly on a case-to-case basis that we decide, and it's really part of what is we keep talking about personalized medicine, tailored medicine for a patient. So that's how you tailor the treatment for a patient. It's the surgery for you will be directed to you. What I do with my patients is I have a whole folder on my computer of all the surgeries that I've done, and whatever I feel is the closest to what the patient has. I show them those slides. This is how it will be before, this is how it is before, this is how it will be post-op immediately, this is how it's 6 weeks later and 3 months later, so that you have a very good idea in your brain about what to expect when you have your surgery done.
Okay, so assume that the patient या एक patient है जिसका आपको जब decide करते हैं कि सारा पूरा breast remove करना पड़ेगा, right? There is no guarantee कि पूरा remove भी करने के बाद whether the cancer comes back or doesn't. तो आपकी treatment protocol क्या होगी? अभी तक मुझे एक ही चीज समझ आई है कि कभी तो आप कीमो देंगे शायद पहले and surgery के बाद में भी.
Again, so now what happened about 12 years ago was a groundbreaking paper published by Europe, which divided breast cancer in 4 बड़ी फैमिलियों में डिवाइड कर दिया उसका टाइप, जैसे हमारे गोत्र होते हैं. So there are 4 main types of breast cancer, and हर एक टाइप की हर एक फैमिली की ट्रीटमेंट स्टैंडर्ड है. कब कीमो करनी है, कब सर्जरी करनी है, क्या कीमोथेरेपी देनी है, वो स्टैंडर्डाइज्ड. So depending on which of the 4 families a patient belongs to, that protocol is already, वो प्रोटोकॉल पहले ही बन चुकी है. उसको दुनिया में चाहे आप लंदन में चले जाओ, चाहे ऑस्ट्रेलिया चले जाओ, सिंगापुर, दिल्ली, बॉम्बे, it's the same now worldwide. That's first line treatment. So to generalize and say, so okay, so as a general rule, there's a type of breast cancer called HER2 new positive breast cancer. So in those patients, unless you have a 5 millimeter or less cancer, you have to give everybody chemotherapy up front. It's better for the patient. The rest you can decide depending on how much do you want to shrink, how much is the disease advance locally, etc., etc. In a patient who comes with a small tumor which has no other spread anywhere, you would invariably end up doing surgery before you did chemotherapy. That's the rule of thumb. So it's the type of disease which very often, and the stage of disease which dictates what should be the pattern. Kaun sa pehle aayega, kaun sa baad mein.
Okay. In a series that we've already done on cancer, which is run on our TV channel on Tata Sky, one of the things that one of the many oncologists we were talking to, medical oncologists, were saying कि एक cancer board होता है अस्पतालों में. So you as a patient, there is something called a cancer board in hospitals. And
it's known as in very different ways. It's called a cancer board. It's called a tumor board. It comprises of different specialists. So you have your surgeon there, you have your radiation oncologist there, you have your medical oncologist there, and in an ideal situation, you have your pathologist there and your radiologist. So you're 5 key people, and the more and more we realize that there is a significant role of nutrition and of physiotherapy in recovery. So you also ask your the heads of or the team members from those 2 teams to join you, and you discuss a patient, finalize the treatment decision protocol, inform everybody. It's all about communication, number 1. Number 2, it's also about patient safety, making sure that you're not taking unilateral decisions that are not right from a safety point of view for the patient, because
the patient can question the board, right? I mean, is that something that...
Yeah, I mean, the patient can question the board, but what often happens is that the decisions that are made by the board are not made on, in my experience, I think this should happen. It is all based on evidence-based medicine.
Sure. And आपने कहा है ना 4 गोत्र हैं, so there are already set protocols.
There are already 4 types of families, IU, and X, Y, Z.
Correct. You know, the chances of you going wrong are very, very limited and rare.
Yeah. I mean, but it's always nice to have a tumor board. So what a lot of hospitals do is that there are 2 numbers. One is a UHID number, which is a unique identity for the patient, and the second, if there's a cancer patient, they have what is called a tumor board number. So it's a documented thing. It's really for both patient and doctors' safety that they should be discussed and approved of in the tumor board. It's also communication. Everybody's on the same page. You're going to have more than one specialist treating you, and if everyone knows what's going on, it's just easier to coordinate and manage things.
Okay. Just the last section before, and I know you've given us so much time, and thank you very, very much. I'm sure you're doing the hospital a great service, and of course the patients and viewers. Moving on, the last bit is post-surgery care.
Yeah.
Okay, now we all know कि India में जो levels of care हैं, आप England से पढ़े हुए हैं, तो आपके certain expectation कुछ अलग होएगी. तो हमें India में क्या जानने की ज़रूरत है? Because I believe breast cancer removal is very painful.
Sorry?
And I believe to remove a breast is, and especially the entire breast, is very painful as a procedure. So post treatment कैसे हम मतलब what is the care?
So the only thing which is in my hands or my team's hands as doctors when we operate on a patient is pain control, pain management. So local blocks, regional blocks, before just starting the surgery, they take down the pain drastically. Use of appropriate painkillers and managing the patient post-op, good physio, timely physiotherapy. These are all things that need to be done, and they're being done. They're being done much better and more frequently by most specialists now than they ever used to be. And the one area which I think it's still a big loophole in our country is the nutrition post therapy or during therapy, because in the West there are whether there's a separate treatment or separate diet when you're undergoing chemotherapy. There's a separate diet pre and post-op, etc. So I think we need a little more focus and emphasis on that. But otherwise, by and large, there is a fantastic increase in the awareness within the medical community as well as the patient community need for physio post-op, so that you're not just the whole idea of treating a patient is curing them, right? You don't want to leave them with a disability if you can. And I think physio plays a huge role along with diet and pain management. Pain management, I haven't addressed it because it should be something which is it's the responsibility of the treating doctor at that point in time. So, and it's the one thing we can control. So, your patients should not be having a lot of pain.
So we hope with Moolchand that's your mandate for setting up a leading oncology based center. I certainly hope you do all of this, and I wish you all the luck and all the good luck. And I hope you don't lose track while you're setting this up in the longer run, because what you say makes so much sense, and that is a crying need. I mean, for example, if I were a patient, then after surgery, I would want to meet with you to find out reconstructive surgery karni chahiye ki nahi, kyun karni chahiye, why on earth is it expensive, how do you save on money?
No, so
so
that's not how it should happen. If you have to have reconstructive surgery,
Ji.
then it's my job to discuss it with you before your surgery happens and give you the options and tell you, look, this is what we can do. These are the options. This is the cost attached to it. And if you decide not to have the surgery, then to fill in the void, then okay, these are the options that you have. Then there are something called prosthetics, which are implants that can be worn within the bra, and what is the best qualities, and to put you in touch with the people who do that, so that you can make an informed decision then about what to do, what not to do. And honestly, I think reconstruction for a breast cancer patient is not just about vanity. It's actually part of therapy, because as a woman, you've got to live with it for the rest of your life. And this is just from, I mean, of course, some of the ideas one has, but a lot of patients have said that it's just so ridiculous getting in front of the mirror. I don't even feel like looking at myself in the mirror any longer. So I don't have one in my bathroom because it's just a constant reminder to me of what was there. But as I said, fortunately, the number of cases of breast removal over the last 10 to 12 years has gone down significantly. And there are a lot of reasons for that. So we don't do mutilating surgery as much as we did when we can avoid it.
Excellent. More power to you, doctor. Thank you so much. And I know you're an exceedingly busy person. You're a super specialist who's got lots of patients waiting, I'm sure. We're not going to hold you anymore, any longer. Thank you for so much of your time.
Thank you. Thank you.
I can just tell our viewers that Dr. Sahni practices at Moolchand. He's setting up an institute, of a certain level of global class. And so please, in case you have a problem getting through to him, get in touch with us. We will see what we can do to have more of you on such shows for public education. Thank you again.
Thank you. Have a good weekend.
All right.
Thank you.
Thank you. Signing off.